My name is Robin Durgee, and I am the Stewardship and Events Manager at the Josselyn Center. We're so glad that you're joining us today. Hopefully this is our last virtual event, and I know some people are watching together, which just makes me so happy. I can't wait to see all of your faces very soon and meet some new people who are interested about what we're doing here at the Josselyn Center. A couple admin pieces. This is the webinar view, so you can keep your soft clothes on a little bit longer. We won't be able to see you or hear you. Also, we've got some great raffle and silent auction items. We'd love for you to jump on and see if there's anything that looks good to you. The raffle and auction will be closing tonight at 11:59 p.m. We are so lucky to have our long-time Josselyn Spring Luncheon hostess, Jackie Waldstein, with us to welcome everyone again for our 13th annual spring benefit. Jackie is the best, and we're so lucky to see her here. Take it away, Jackie.
I want to welcome everybody to our spring benefit, and unfortunately we cannot all be together, but our spirit is, and that's what counts. We need the Josselyn mental health services now, today, probably. We always did need them, but we need them now more than ever. So everybody hang in there, please do your part, and please donate to Josselyn Mental Health Center.
Good afternoon, everyone. I am Clyde Walter, and I have the privilege of serving as the Vice President of Mission Advancement here at the Josselyn Center, where I get to work with staff and volunteers to sustain, strengthen, and grow our mission in hopes of eradicating barriers to quality mental health care. I want to take just a brief opportunity to once again thank you all for joining us this afternoon. We wish we could be together in person, but look forward to the days where we can once again. I want to especially lift up Josselyn's auxiliary board under the leadership of Mary Walmsley and Valerie Michaels, and especially this year's host committee for partnering with us to put on this afternoon's event. As Jackie said, our work in providing comprehensive mental health services has always been needed, but it is truly needed now more than ever before. We're seeing over 100 new clients each month, 55% of which are children, adolescents, or young adults. To offer you a window into just one teenager's experience of why our work matters, we bring you now to Sydney Kellenoff, a sophomore at New Trier High School and a member of Josselyn's junior board.
Hi, my name is Sydney Kalinov, and I am one of the sophomore high school students on the Josselyn Center Junior Board. And I'm on this board because I'm really passionate about mental health and the destigmatization of mental health in general. I have some family members that are afflicted by mental health issues. Being a member of this board has really made me more appreciative of some of the challenges that they face. And overall, I'm really glad to get to learn more about mental health and work with other people my age. I know that this year it's been difficult because of COVID to have a lot of events, but I think that our membership has increased and we've been doing so well as a board overall. This month, last week, we were working on a partnership with the Happiness Project. And the Happiness Project is basically an organization created by college students working as for the same mission that we are, is the destigmatization of mental health. And on the 17th, 18th, and 19th, we ran live streaming question and answer sessions, and we did virtual art therapy through the Josselyn Center. And we've been partnering with the Happiness Project for the entire month of May. And in the month of June, we have an event with Jordy. He's an upcoming artist, and we're really excited to work with him. And we're holding a concert on Sunday, June 13th. It's going to be a live benefit, and all the proceeds will go to the Josselyn Center. We're super excited about that. Again, I just wanted to thank you for everything that you do. And without your donations and continuous support, we wouldn't be able to do what we've been doing throughout these unprecedented times. Thank you so much.
We are grateful for the passion of Sydney and her peers on the junior board who fiercely champion mental health in their schools and the wider community. Now, to offer you an even deeper window into our work this past year, we bring you to Patrick Dolly, who joined Josselyn as a clinician during the pandemic after having served as an intern here previously.
My name is Patrick Dolly. I'm a licensed social worker here at the Josselyn Center, and I do therapy with children, adolescents, and adults. I grew up around the North Shore and was very fortunate to secure an internship with the Josselyn Center for graduate school, and was brought on as a therapist afterwards. And now I've gotten the opportunity to work with clients of all ages, some local, and as we've expanded into Lake County in the last year, I've gotten a chance to work with clients in Northern Illinois, the far northwest suburbs. And it's been a real great opportunity for me and a privilege. Across the board with Josselyn Center clients of all ages, we've seen a real difficulty accessing resources, and this can be employment resources, housing resources, social resources, clients who are in recovery for alcohol, other substance use. A lot of these challenges we've seen, and the virtual environment we've all been practicing in has not afforded everyone the same ability to participate in social groups and other supports that have been really crucial. And Josselyn Center has made it a mission to have different departments lined up so people could use the center as a one-stop shop. I get to communicate with employment specialists. I work with other case managers who help clients access resources, navigate government bureaucracy, access other financial benefits, secure housing. And it's really amazing to be able to work with people who can help clients across the board secure all the needs that one would have living life and trying to manage in a metropolitan area like Chicago. As a therapist here at the Josselyn Center, I see clients of all ages, children, adolescents, adults. I have a cohort of high school students that I see, and of course there's been so many changes over the last year plus, and it was very difficult. I've noticed, and many other therapists have as well, how a lot of adolescents and children were not able to have closure leaving their school when they first had to make the transition to a virtual environment. It was really difficult to have the social support pulled away. Students who are participating in athletics and drama class and chess club across the board, all the extracurriculars, taking the bus to school, walking back and forth with your friends, stopping to get a snack after school, all these little moments during the day, people weren't able to have as much. And of course, when people were home, it means they would need to spend more time with family. We saw some family tension pop up in the course of the last year as a result of the other social supports and academic supports not being there. So it's been really challenging for many adolescents. We've seen an increased need in the community at the Josselyn Center, and our leadership here has really been on top of the ball, making sure that we have enough intake staff, which is our front line. Our intake team has been phenomenal. They talk to clients. They're the first people that clients communicate with when they come to the Josselyn Center. We get that process streamlined so that people are able to meet with therapists, psychiatrists, case managers, employment specialists very quickly, so that there's not a long waiting list, which is something that we see is very common in the community. And the Josselyn Center has been able to grow and to meet the need by adding admin staff, records support, all the billing support that goes along with handling an increased client load. And that's freed up therapists to do more clinical work. So I've been able to spend much more time with clients to do the work of therapy, and that's been really helpful, I know, for me. I want to thank you all for the support you've given and continue to give to the Josselyn Center. We all know there's been such an increase in the need in the community, and we're so fortunate to have your support.
Patrick's testimony reflects what so many of our clinicians are seeing and what our clients are experiencing, and ultimately why we are growing to meet the incredible need around us. To step out now to a wider lens view of mental health as part of holistic health, we turn now to our featured speaker, Dr. Lucy McBride. Dr. McBride is a practicing internist in Washington, D.C., who believes that mental and physical health should be addressed in tandem. Her goal is to reduce the stigma around mental health and give people hope, information, and direction to better advocate for and improve their whole health. Over the course of the pandemic, Dr. McBride's newsletter has become a trusted source for real-time, fact-based information, advice, and commentary to help people assess their ongoing vulnerability, manage their physical and mental health, mitigate COVID risks, and better understand vaccines, variants, and evolving public health recommendations. Dr. McBride is an educator, a frequent media guest, and an op-ed writer. She graduated from Princeton University, attended Harvard Medical School, and did her medical training at the Johns Hopkins University. A native Washingtonian, Dr. McBride is married with 3 teenage kids. Lucy, we're so glad to have you with us this afternoon. The floor is yours.
My gosh, that's such a wonderful introduction, Clyde. Thank you so, so much. And just to say this, I'm so incredibly impressed with the Josselyn Center, your mission, your steady hand through the pandemic. And it's really an honor to be here today talking to you about what Clyde said, which is sort of let's kind of zoom out on the pandemic and think about it the way I like to do with my patients one at a time. And now I'm speaking to a wider audience through this COVID newsletter that I started back in March 2020 out of necessity to help my patients manage the fears and facts of the pandemic. And now it's gone, if you will, viral. So feel free to sign up for my newsletter. Tonight I'll be writing about the Yankees outbreak and what that means. So why, as an internal medicine doctor, practicing primary care doctor in Washington, D.C., talking about mental health? Why is it not a psychiatrist or a psychologist? Well, the answer is very simple to me. The answer is this: our mental health directly informs our physical health. Our mental health and our physical health are intrinsically related. Mental health is health. Our everyday thoughts, our everyday feelings drive so many of our behaviors, and our behaviors drive so many of our medical outcomes. Take, for example, a patient I saw this morning who is a working mom, has been struggling to parent her kids through the pandemic. As a result of the stress of her job and managing kiddos who are in distress, she's been drinking more alcohol to take the edge off the stress at the end of the day, which is understandable. As a result of alcohol, is not sleeping that well. Her blood pressure is high in my office. She's got headaches. She's exhausted. My job as a doctor, as an internal medicine doctor, is not to say, hey, tisk, 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 knock it off with the wine. It's rather to understand what's going on in her life and to help her collect and gather coping strategies to manage the very real stressors in her life. Of course, my job is to manage her blood pressure and to counsel her about the effects of alcohol on sleep and stress and how it affects blood pressure, but it's also to see the whole person, to zoom out and understand that her everyday thoughts and feelings are driving behaviors, and her behaviors are driving her health. So what have we experienced here in COVID-19 over the last 15 months? Well, I think you already know, but it's a collective trauma. We all experience loss and grief in our life. It's part of the human condition. It's part of the human experience. It's what makes us human. It's what binds us. And COVID-19 has been nothing short of a trauma. Whether or not you have lost a loved one, you have lost your job, you have lost the contours, routines of your daily life, you have lost your in-person school experience, or you've lost the safety and security of friendships and relationships and the security of just normal life. We have all experienced loss in some level, in some way, along some axis. Before the pandemic, as you all well know, diseases of despair were on the rise. Depression, anxiety, addiction, suicide rates have gone up. The opiate epidemic was booming, if you will. And then you add a collective trauma like COVID-19, where we've been robbed of our normal coping strategies, like getting exercise, going to the gym, meeting a friend after work, taking a walk with a loved one, robbed of our normal coping skills. And then with the added stressors of caring for our loved ones, worrying about COVID risks and all of the restrictions on ourselves and our kids, it's no surprise that people have felt undone. What I'm seeing in my office every day, and it's changing, week to week as the public health landscape changes, is really, a lot of unbridled fear, a lot of anxiety, depression, accentuated disorganized eating, a gravitational pull to coping mechanisms that don't always serve us, like drawing to alcohol or marijuana or other recreational drugs. Stress and emotional eating are very, very common. I mean, who doesn't know the feeling of having a bad day and going to the refrigerator and grabbing some ice cream? Well, that's okay every now and then, but if you're self-medicating an anxiety issue or depression and it's affecting your health, then that's something that comes to my office and should be under the umbrella of medical health, because again, mental health is health. My job isn't simply to go through what you're eating every day, but to understand your relationship to food, your relationship to alcohol, your relationship to your kids. How are you doing at home with the stress of the pandemic, with your spouse, your partner, and how is parenting going? How are your teenagers doing? I have 3 teenagers. Each of them has suffered in different ways. They're going to be okay because we have an open dialogue about feelings, for better or for worse. Their mother loves talking about feelings. Sometimes they wave the white flag on feelings. They think, Mom, I'm fine. There's nothing deeper. There's no hidden meaning to that look I just gave you. But the point is that kids have suffered enormous losses in the pandemic. Kids need school like fish need water. Adults have learned over time how to cope with uncertainty and stresses much more than kids have. At the same time, kids in general are more resilient, although let's just face it, there are kids who are pandemic proof, and there are kids who are really suffering invisibly behind closed doors from isolation, loneliness, despair. The ER visits just reported in San Francisco have gone up for self-harm and suicidality. It's time now, on the eve of reentry, as people are getting vaccinated and people are able to re-enter parts of their lives, to really start assessing the collateral damage of pandemic restrictions on all of us, but particularly to kids. One of the ways that I help people combat anxiety, which, by the way, is part of the human condition, so if you're anxious in a pandemic, that makes you normal. One of the ways I help people combat anxiety is, number one, let's name it. Let's call it what it is. We are anxious. We are wired for survival. So it's only normal in a global pandemic, when there's a lethal virus circulating without a cure before the vaccine. We are anxious. We are wired and tired. We're sweaty. Our muscles are tense. We're not sleeping as well. We don't feel well. Our blood pressure is higher. Our blood sugars go up. We gravitate towards unhealthy behavior. So we name it, we normalize it, and then we navigate it. So my job, like I said in the beginning, is to help people build a kit of coping strategies, from practicing meditation for 5 minutes before they go to bed, making sure they prioritize sleep, making sure that we understand the science around sleep, that sleep is the balm. It is essential for mood regulation, managing stress, cognition, attention. It also is good for our blood pressure and for our cardiovascular health to get adequate sleep. So prioritizing sleep is essential. Getting 3 meals a day, even if it's difficult. Breakfast should not be a cup of coffee. Lunch should not be a kind bar, and dinner, wine and cheese. Although I will admit that those have been my meals during the last 15 months on occasion. My point is that we want to get satiated with meals, if we have that luxury, ideally 3 times a day, so we can maintain focus, maintain concentration, maintain energy, and so we can parent and care for our loved ones and care for ourselves the way we're meant to. Because feeding ourselves, moving our bodies, sleeping, and practicing self-care is ultimately really, really important for our mental health. And then, of course, asking for help. If I teach my kids one thing, it's that asking for help is a strength. When we are struggling, it's time to say, I know what I can do to help myself. If I go for a walk, I feel better. If I go out in nature, I feel better. If I take a virtual yoga class, I feel better. But if we're struggling, we're sleepless, we're anxious, we're ruminating, we're having trouble managing our relationship to food, alcohol, recreational drugs, we're having relationship problems at home that aren't going away as the pandemic restrictions lift and we are able to re-enter life, that is time to ask for help, whether it's from a trusted colleague, a close friend, psychotherapy. I'm a huge believer in psychotherapy. I kind of feel like it should be required for everyone, just like we require, science, math, and English in high school. I do feel that adolescents need to have an emotional education on the very real inner worlds that we all experience in our lives, particularly as we experience this trauma together. And then the last thing I recommend, there are a whole host of things I recommend to patients for managing stress, anxiety, trauma, in addition to the things I just mentioned. And it's really a tailored set of recommendations because, of course, there's no one size fits all prescription for someone's experience, someone's lived experience, and someone's emotional health issues that, of course, affect their physical health. But one of the key points I've been making through the pandemic in my writing and in my media appearances is really this, that we need to make sure we are rooting our behaviors in facts. We also need to make sure that our policies in the public sphere are rooted in facts. As you know, there's a lot of information coming at us 24/7, like drinking water out of a fire hydrant. And one of the reasons I started writing my newsletter is because people were drowning in information. Who do I trust? What do I believe? Which test? How long do I quarantine? What's the definition of a fever? So right now, this is where we are. We have 3 stunningly effective vaccines. It's important to understand the facts of the vaccine because that is an antidote. You understand the stunning efficacy of these vaccines and just how safe you are after vaccination. That can begin to help put you back on the road to recovery from this trauma. The 3 stunningly effective vaccines are, of course, the mRNA vaccines, the Pfizer and the Moderna vaccines, and the Johnson & Johnson vaccine. Those 3 vaccines basically take death and severe disease off the table if you're exposed to coronavirus. They make the risk of getting COVID-19 at all, whether it's a sniffle or a cough, extremely low. In fact, it's almost hard to get COVID-19 after you've been vaccinated. And they block transmission. So it's difficult to give someone else COVID-19 or transfer coronavirus to them once you have been vaccinated. Is it impossible? No. There's no such thing as a zero risk life, just like there's no perfect vaccine, but these vaccines are truly triumph of modern medicine, and they are as close to perfect as perfect can be without perfect being on the menu. And if you're interested, you could read about my take on the New York Yankees story tonight, which basically in short is a story of vaccine efficacy. When 7 out of 8 people who test positive have no symptoms, and one of them gets a cold, that's what the vaccine is supposed to do. No one went to the hospital, no one got sick. And by the way, those people who were not symptomatic should not have been tested in the first place because we don't need to know about teeny bits of virus in our noses that can't transmit to other people and cannot sicken ourselves. So the way I see it now is that when you've been vaccinated, it opens the doors to resuming normalcy. The problem is when you resume normalcy after you've been marinating in fear and stress hormones for 14 months, that invites its own set of stressors. So it's only normal, as I'm saying to my patients now, to feel a mixed set of emotions as we face reentry. I've enjoyed being on the couch on Saturday nights with my husband and my dog in elastic waist pants for 14 months. And now I'm being invited to go out to cocktail parties. Do I want to do that? Does that give me a little social anxiety? Absolutely. Not only that, people are being asked to go to work. Kids are being asked to go, on play dates. Parents are faced with an impossible situation where their kids are not yet eligible for the vaccine, yet they want kids to re-engage in regular life. So, there's a lot of anxiety that comes along with normalcy. There's also the bigger question, the existential question I was talking about on NPR yesterday with Ari Shapiro. What is normal? What is being human? Maybe this is a moment to contemplate what we actually need to feel human, to feel mentally and physically healthy. So the last thing I want to say is just about kids, and then I don't know how much more time I have, but the frontier right now is really about kids. So as I was saying earlier, and as you well know, kids have suffered unmeasurable losses during the pandemic. Without school, without their peer relationships, without, frankly, the safety of the four walls of the school for many kids who need school to be safe and to be fed, kids those calculations are not adequately being done. The mental health toll that is on our generation of young people. Right now, as you know, the FDA has issued an emergency use authorization for the vaccine for 12 to 15-year-old kiddos. I have gotten my 15-year-old daughter vaccinated. I call it her teen ticket to freedom. What we know right now, based on enormous amounts of data, and the success we've seen in hundreds of millions of people being vaccinated safely with the mRNA Pfizer vaccine, is that the Pfizer vaccine is safe in this age category. It does not cause infertility. This myth is a nasty myth that's going around and unfortunately casting doubts on a very, very enormously effective vaccine. So the Pfizer vaccine for 12 to 15s is safe, does not cause infertility. My daughter had a sore arm for about 6 hours, and then her only side effect was joy at the ability to go back into her regular life without fear, the same fear that we've all been stewing in for 14, 15 months. It also will allow her to go to camp and go back to school unrestricted. What are we dealing with though on the younger kids is that the 12 and unders or the 11 and unders are not going to get a vaccine at their disposal for many, many months. Here's what I'm arguing, and I'm actually working on an opinion piece on this right now. The science is clear, the data is clear. Kids are very, very low risk, particularly in the 11 and under age category for complications from COVID-19. Have kids died from COVID-19? Tragically, yes. Have kids gotten very sick? Yes, but very, very, very few. So the risk of COVID-19 in kids is on par or less than the seasonal flu, which of course is not something we want to, engage with every season. But what my point is when we contextualize the risk and understand how very low risk kids are, and we also understand that kids are indirectly protected with each passing day as more shots go into arms and adults are vaccinated, and adults can't transmit the virus to the kids are indirectly protected with each hour of every day in this luxurious place called the United States, where we have lots and lots of doses of vaccine. And finally, people are getting vaccinated at rapid pace. The other thing is this: we need to really, really start measuring the emotional and mental health toll on kids from pandemic restrictions and put that into the calculation when we're making decisions on whether to send our kids to a play date, to hang out with the neighborhood kiddos, and then of course in terms of policy for camp and school. I don't have a crystal ball. I don't know everything, just ask my kids, but if I had to guess, that certainly by the school year in August, there will be no masks on kids. There will be no need to have any pandemic restrictions because we will be in a completely different landscape in place. And I'm hoping, I'm among the people banging the drum, that we need to, once the public health landscape has gotten even better, which will be in the next 2 weeks, 3 weeks, that kids can unmask indoors and outdoors, whether or not they're vaccinated, with, of course, so many caveats on that, because every kid is different. Every child is different. Some kids are at high risk. Some kids live with high risk individuals. But the main point is this, and I'll close on this. Hope is alive. Help is on the way. Help is here. It's also normal, however, as we face reentry, to experience ambivalence, anxiety, hesitation. And just because the CDC guidance changed overnight does not mean that our brains, our thoughts, our feelings, and our behaviors will change overnight. So we need to be gentle with ourselves as we transition and gentle with each other. And we will get through this together, as we have many, many other tragedies. And I will end there and say thank you so much for having me.
Well, thank you, Lucy, for this timely message. And now we'll just, turn to a few questions, and actually really want to pick up sort of where you were, closing in here at the end with this whole idea of measuring the mental health toll, measuring the toll of mental health on our, all of us, certainly our younger people. So certainly understanding what you're suggesting in line with all the other things we're measuring around the disease and physical and environmental health. But what are your thoughts about how we can carry this idea of measuring the toll of mental health forward into a, when we're in a truly, post-pandemic world, and how we consider that in the same way we consider the effects of physical and environmental health?
Clyde, that is just such a great question. So my dream and fantasy is that we would someday, in every doctor's office and around every kitchen table, and in public policy and in ourselves, that we would destigmatize mental health as something that is separate or a luxury to the rest of our health. I mean, we have cardiovascular health, we have, women have breast health, we have kidney health, we have mental health. To me, it's just so uncomplicated, yet there is still enormous stigma around being human. And to struggle with mental health is to be human. The other important thing I'll say is that, mental health and mental illness are two different things. We protect mental health and we address mental health to help prevent mental illness. Sometimes mental illness is not preventable, even despite our best efforts. But we all have mental health. As I said to someone yesterday, you can't opt out of having mental health like you can opt out of having like a feature on your iPhone. Like, you have it. So it's just whether or not you look at it or not, and whether you address it. So I think the first step in terms of trying to quantify mental health and how to then measure mental health losses is really to start naming it and calling it what it is, bringing it to your doctor, bringing it to your pediatrician, understanding that when you name and normalize anxiety, depression, trauma, grief, loss, you're basically saying I'm human. And I think that, these things are harder to measure because there's subjectivity, right, in how much suffering people are having, and people can suffer on varying different levels. But just because it's harder to quantify and measure doesn't mean that mental health shouldn't go into the calculation when we're making risk benefit ratio decisions in our everyday lives. Does that make sense?
Absolutely. Thanks so much. You're striking certainly several chords with us with the notion of accessibility to mental health care, and then also the notion around prevention and early intervention that is so dear to us here at the Josselyn Center. So I know many in our community are really, thinking a lot, especially about the longer term effects on adolescents, specifically this whole idea of missing about 15 months of normalcy and what the toll will be on their body's immunity, their social skills, and their education. Have these kids effectively, taken a step back through this experience?
As you know, Clyde, I mean, every child is different. I have 3 kids and they could not be more different. One of them is a 5-alarm extrovert and was struggling so hard because, we had to tack him down in the very beginning. My middle child is an introvert and was sort of, if you will, living his best life for the first month and a half, sitting on the couch with his parents on Saturday night. Who's a 16-year-old, sort of teddy bear who's 6'3". But in general, we know kids have such varying experiences, but we also know that they have experienced unique losses because they need school. You and I have different parts of our life that we engage in. For kids, school is really everything. And so I think it's important that we really acknowledge the losses kids have experienced, and then allow them to gradually talk about those. And like I do with my kids, I do with my adolescent patients. If they don't want to talk about it, that's okay. But you can also open the dialogue and even sometimes give them the vocabulary with which to talk about. So for example, I saw an adolescent patient earlier this week, and she's clearly distressed, but doesn't know how to put words to how she feels. And so I said, "Was it fair to say you're a little overwhelmed?" And she just kind of nodded. And so I think just acknowledging and validating how people feel. As you know, teenagers don't love talking about feelings, particularly with grown-ups. And they also don't necessarily have the vocabulary with which to talk about what's going on internally, yet they have a very, sometimes volatile emotional life that affects their behavior. So we really need to get them to download those thoughts and feelings and then find a trusted resource. It might not be me, it might not be their doctor, it could be their pastor, their rabbi, it could be their coach. But again, all the more reason to get kids in school. They need those mentors, they need those safe, allies, they need their peers. But again, they also are going to need some added help. We know in the adult world, so many of my patients who suffer from cardiovascular disease, diabetes, obesity, so many of those adult medical conditions are rooted in childhood trauma. And so it's really important that we name trauma for what it is. But also, if you have a kid who's pandemic proof and is just vaccinated and off to the races and happy as a clam, that's lucky and great.
Yeah, thank you. And you hit on something, in this segment, but I heard you speaking about this yesterday on NPR, and it affects all of us. I think this notion that, especially those of us who may have been introverted before the pandemic, but even those of us, I mean, I'm an extrovert by designation, but I have really appreciated more inward time in this year. And I don't know that I want to go back to how I lived my life completely before the pandemic. And so can you talk to us about that sort of negotiating what for some of us may have actually been an unhealthy way of living life pre-pandemic, and now we've had this disruption, and how do we kind of come out into the world again with this opportunity to do so a little differently?
Again, Clyde, you're asking the best questions. I could talk to you for hours. It's hard to talk about opportunity in a pandemic, but as Rahm Emanuel said, never let a good crisis go to waste. One of the silver linings, if you will, for me in the pandemic, and I hope for a lot of other people, and I know it's happened for a lot of other people who've had the luxury of time to reflect on these things, or have done enough therapy like I have, where you're reflecting on these things because you've been trained to, is that there are parts of our lives that we left in March 2020 that were not normal, that we didn't want, that we were passively ingesting, the sort of go, yes, life, or maybe it was some other version of life that just didn't suit your needs. When you think about health from the ground up, it's really not just about seeing the doctor once a year and checking your cholesterol and getting on the scale, right? Health is about meeting your broad human needs. It's about our everyday experiences. It's about how we manage stress. It's about safe and productive relationships. So one of the things that I've been doing, and I've been talking to my patients about, and what I'm going to be talking about more in my newsletter, is this concept of post-traumatic growth. We know about post-traumatic stress. Some of us, all of us arguably, will feel some level of post-traumatic stress, and like twitchiness and anxiety when we, the first time we get a fever after, the pandemic is well behind us. But there's also post-traumatic growth where you can take stock of where you are, find meaning in having had this time that you didn't want, to assess what it means for you to be healthy, an extroverted introvert or an introverted extrovert. I realized, small talk is really not my thing. Like, I'd rather go right to the meat of the matter. You know what I mean? Like the water cooler conversation, I can do it, but I'd rather just talk about, like, when you see someone at work again, instead of doing the water cooler conversation, just say, hey, it's nice to see you. Like, you don't need to do the how's the weather, or, it's interesting, that sweater you're wearing is nice. I mean, that's fine, but I'm just saying, like, take stock of what you need to feel healthy. Maybe you need 3 solid, good friends and not 20 who you see, running around all the time. Maybe you need 8 hours of sleep instead of 7.5 to feel healthy. Maybe you don't want to commute all the time if you don't have to. Maybe you enjoyed more time with your kids. Maybe you enjoyed less time with your kids when they finally went back to partial school. So I think it's a moment in time to really take stock of what you need to be healthy. And it's also a moment to realize that saying no is okay. As the person I did the podcast with yesterday, who's a public theologian, said, no is a full sentence. If you are not meeting your needs and you're saying yes when you mean no, you don't need to even explain to the person why I'm saying no. No, thank you. And that's okay. Stay in on Saturday night, meet your needs, get more sleep. But also realize that human connection is part of the way we're healthy. And so we want to make sure that we are not isolating. We want to get out there and connect with people who fill us up and make us feel whole and make us feel healthy.
Nice, spot on. And I know in my social circle, we've been talking about, maybe not as many active relationships, but having key ones that we go deeper into, this idea of being real and vulnerable.
That's right. I mean, we live in such a world of, like, I'm on Twitter, and it's so emblematic of the fast-paced world we live in, where relationships are fleeting and fast. And maybe we can get back to a new normal or a better normal, where we really value things that make us feel healthy. And it's often just the basics: relationships, eating, sleeping, moving our bodies, being in nature, prioritizing our mental health. That's basically it. The rest of it is gravy.
Yep. No, that's wonderful. Well, we are so glad to have had the opportunity to have you with us this afternoon, and we will continue to follow your work and your words in the days ahead. Thank you so much.
Thank you so much for having me. And again, congratulations to all the work you're doing. You're more needed than ever. And thanks to the Josselyn Center. You guys make a great team, and it really does take a village.
Absolutely. Now we turn to Josselyn's CEO and president, Susan Resco. For those of you who don't know Susan, she is a fierce champion for access to quality mental health care. After launching her career in banking, Susan moved to work in mental health advocacy, eventually serving as executive director of the Balanced Mind Foundation for nearly a decade. Susan took the helm at the Josselyn Center in 2015, and under her leadership, Josselyn has grown fivefold in 5 years to further support the need in the over 90 communities we serve. Susan, take it away.
Thank you, Clyde, and thank you, Dr. McBride, for sharing your insight and wisdom. And thank you to all our guests for joining us today. Your participation could not be more timely. And as we've been talking about, the second wave of the pandemic is hitting children and teens in the form of acute mental health needs. And we're seeing this at the Josselyn Center. As Clyde said, 55% of our new clients this year are children, teens, and young adults, and our volume has more than tripled. So what are we doing to address this? This summer will bring a lot of changes. First, we've hired 2 full-time child psychiatrists who are finishing their fellowships at Rush. This will make our child psychiatry team one of the strongest in the state. We're launching an intensive outpatient program for teens, similar to Compass or Rogers, you may have heard of, but unlike these programs, we will support low-income teens who do not have private insurance. This program is for teens who need more support than weekly therapy. It's short-term in nature, and it's intended to return them to a regular routine with better coping skills and strategies. And thanks to the generosity of Gailey and Neil Fitzpatrick, we purchased a building 3 doors down from the Josselyn Center for our kids in this program. And in response to the junior board's 50+ teen requests, we have launched the Teen Mental Health First Aid, which teaches teens how to recognize the signs and symptoms of mental health challenges in themselves or their friends. And just as important, why it's so critical to connect with a trusted adult to receive support. And of course, we can't forget Camp Nika, where we expect to support 35 children this summer. I remember my first Camp Nika luncheon at Josselyn just 5 years ago when we hosted 7 children. Things have really changed. But how are we doing it? Well, it's with your help. So I'm here today to ask you to please donate to the Josselyn Center so that we can continue to support children and teen mental health services. So your support, as the slide says, $10,000 will support our junior board for an entire year. That's 50 kids who fight stigma and influence programming and are changing the way future generations think about mental health treatment. $5,000 supports a child for a year of therapy for an uninsured child. $2,500 supports a scholarship for a child to attend Camp Nika. $1,000 supports outreach for a local high school. $500 supports teen mental health first aid training, and $250 supports a new psychiatric evaluation for a child. We can't do this without you. I know you're here because you value mental health and you know how important early intervention is for our children. So please dig deep and make a donation in one of 3 easy ways. On behalf of the 600 children we support, thank you for your generosity.